This week, we've seen a lot of mixed signals about reopening the country, when to do this.
That's right. It's Thursday morning, so we're joined live with Dr. Hawkinson from the University of Kansas Health System, as always, on Tuesdays and Thursday mornings. Dr. Hawkinson, always a pleasure to talk to you. We know every place is on its own timeline, even here locally, as we're just talking about.
Yeah.
Talk about that acting prematurely a little bit. You've talked about this extensively from there. Is there such a thing as doing this too soon?
Yeah, I mean, that was a very valid quote by Mayor Lucas. Certainly, there's always a concern over, are we doing it too soon? We know that in Kansas yesterday, they had their highest total number of daily cases diagnosed. I know Missouri's are a little bit lower, but you know, we are still seeing a lot more people infected. As we roll out more testing, we are seeing more people who are coming up positive for the test. But, you know, as a health professional, I would probably say, yeah, we're doing it too soon. You know, there's still a lot of virus out there that will be infecting a lot of people. But as an American and a Kansas Cityan, it's hard to say, because we really need to get other things back on track, like the economy, like getting people back to work. So it's a very difficult question for sure.
Something else we've seen developing, the hydroxychloroquine situation. Talk to us about the trial, because this week we heard about a study of more than 360 patients at VA medical centers found that anti-malarial drug actually showed no benefit and lined up to higher rates of death. And we know that there was a trial set to start at University of Kansas Health System. What's going on now?
Yeah, no, I think one of the other things that as we move forward and we are seeing, you know, more cases and have had more cases in the United States, we are really seeing a lot of good data now coming from the United States and studies in these drug trials done in a clinical fashion so that we get good information. I think this was a very good study. Again, we should note that it's a retrospective study, so they went back to charts and reviewed those things. But I think the data is very good, and the message that it has sent is very good as well. And we need to continue, and we've said this from the beginning, to continue to make sure that the medicines that we're giving our patients and your loved ones are safe, because we certainly don't want to do more harm than good. And I think that this study, you know, it's a smaller study for sure, but it's one of the better ones that we have, did show that we've had some danger from giving this medicine, especially in the combination with azithromycin.
I think
Does that mean the study at KU Med is going to move forward with that still?
Well, the HEROES, that's a little bit different. As far as I know, the HEROES study is still on. That is more of a prophylaxis study, so that is a study to help prevent the disease. The study that the VA looked at was a study of treatment, so it's two very different aspects. And again, it will just be hydroxychloroquine. It won't be in combination with azithromycin.
Interesting. Okay.
And that medical question, along with when we're going to get back to work, I think are the top two questions for everyone right now. We're all wondering about, is there going to be a vaccine for this soon? Another medicine that some people may have heard a lot about, along with hydroxychloroquine, is the remdesivir. Can you tell us some more about that, kind of update us on what the analysis of that is right now?
Yeah, the initial reports from the New England Journal of Medicine, again, it was another small study, but it was a random controlled trial, so they were looking at people getting treatment for coronavirus, not for prophylaxis, but for people who have coronavirus getting treated by remdesivir. The initial study did show favorable effects, so they are still enrolling. They are still doing that. Remdesivir is still being trialed on a clinical basis, again, so that we can get good data, make sure that it is safe, it appears safe, but to make sure that it is efficacious and has benefit to the people that we give it to.
All right, that's Dr. Hawkinson from University of Kansas Health System. Thank you so much. We'll talk to you again in about 10 minutes. Thank you.